we go. Breast cancer. What women need and want. Hello, I'm not a medical person. I'm an artist and a retired academic. But when it comes to breast cancer, I'm a patient pioneer, and I can tell you what women need and what women want.
Yeah.
I'm lucky to be one of the first women to have had my breast cancer treated using cryoablation. That procedure by Dr. Peter Littrup was in 2003, and it saved me from a mastectomy. I've been cancer-free for 13 years. This isn't me, this is my computer. Oh no. I come from the United States of America, from the beautiful state of Oregon, located in the northwest corner of the United States. My home state is beautiful, full of lush green nature, but Oregon has the second highest breast cancer rate per capita in the U.S.
Wonder why.
Why?
Wow. Yeah.
Why? Like many environments around the world, man-made environmental dangers have contributed to the rise in breast cancer. In the early 1970s, the defoliant Agent Orange was tested in the Oregon forest for use in the Vietnam War. After the war, the U.S. military sold this herbicide back to Oregon, and it was used in the forest industry until 1998, when they changed to other herbicides. Women in the States have had more than 30 years of herbicide exposure. The incidence of breast cancer later spiked around the testing sites of the Cascade and Coastal Mountains and the agricultural region of the Willamette Valley, where I come from. Our corner of the U.S. also hosts the Hanford Nuclear Waste Storage Facility. When I was in college in the 1970s, I had a job working on a study that tested for radiation occurring in the food chain of the Columbia River. This study determined that the radiation leakage from Hanford was getting into our food at dangerously high levels. The level of radiation contamination were so high that none of the students working on the study would eat free shrimp and fish offered to them after it was analyzed. During this period, my mother contracted and died from breast cancer. A good friend of my mother's also had breast cancer at the same time. As a result, her daughter, my childhood best friend, and I experienced together the tragedy of having a mother with breast cancer. I brought that childhood best friend with me on this trip to Fuda. I would like to introduce Dr. Diana Taylor. Diana, would you please stand? And then oh yeah, somebody can stand. She's not here. She's from San Francisco, and she'll be joining me. So. Diana is a nurse scientist emeritus and emeritus professor from the University of California, San Francisco. Her program of research has been on improving women's health and experiences through evidence-based prevention, health promotion, and care delivery. She's also a published author who co-wrote the book, Taking Back the Month, that offers helps to women having difficulty with their menstrual cycles. Unlike myself, Diana understands the language of medicine and healthcare delivery. Diana came with me to China so that she could see firsthand how advanced Fuda is in treating cancer, so that she can help me advocate for breast cancer cryoablation when we get home. We are advocates for cryoablation because our mother's illnesses and subsequent deaths have haunted us all our lives and influenced our interest in healthcare and a healthy lifestyle. When I contracted breast cancer in 2003, I was determined not to let it win, not to let it take my breasts nor my life. My determination to avoid a mastectomy led my husband on a search that ultimately resulted in my treatment by Dr. Peter Littrup. As his first breast cancer patient, I am grateful for his commitment to this innovative treatment option. During the 13 years since my treatment, my husband and I have maintained a website with information about cryoablation. We wrote a book together with Dr. Peter called They're Mine and I'm Keeping Them, which is about my cryoablation experience. I have given talks to women's groups, and my husband and I also maintain a popular social media site on Facebook called Keeping Them. In addition to these activities, we have formed a nonprofit organization called the Breast Freeze Foundation. Our acronym is BFF, which in America is Internet shorthand for Best Friends Forever. Our hope is to actually be best friends for many women by raising money to fund treatment for women unable to afford cryoablation for breast cancer treatment until such a time that it's covered by insurance. I am happy to report that our efforts have spread awareness about cryoablation, and it's having an effect. This last April, a feature article about my story and the preventative protocol I'm about to suggest to you was written by health writer Charles Moore. It was the most popular article on the Breast Cancer Weekly Digest site for that month, the month of April, and it was reposted over 1,700 times, which led to lots of new connections and networking. One of my new networking friends is Ingrid Edstrom, a nurse practitioner researcher who uses a military-grade infrared camera in her clinical practice of imaging women's breasts. She uses a sensitive infrared technology as part of her proactive breast wellness program, which provides early detection of breast cancer problems combined with advice for restoring women's breasts. Ingrid contacted me through our website because she had a patient whose breast cancer was treated by Dr. Littrop using cryoablation. Ingrid shared her patient's before and after infrared images. She told me that she had never before seen such an amazing return to normal breast tissue after treatment for cancer. Ingrid was so impressed by the success of cryoablation that she now works with us promoting cryoablation in America. By sharing awareness of cryoablation over social media with women seeking an alternative treatment, my husband and I feel we have gained a unique insight into what women need and what women want in relation to breast cancer treatment. This insight is what I'd like to share with you today because we feel that it can help bring cryoablation to the forefront of breast cancer treatment in the world. We've learned that while women need a cure for cancer, they want that cure to not involve losing their breast through a mastectomy or disfiguring it with a lumpectomy. While a cure for breast cancer might someday achieve these goals through this simple action of merely taking a pill, that day has not come yet. In the meantime, cryoablation can put breast cancer in remission, giving women what they need while not disfiguring a woman's breasts, thus giving women what they want. The advantages of cryoablation are many. It is breast conserving. I avoided a mastectomy. It has low morbidity. I never needed to take more than a Tylenol, and it's inexpensive when compared to surgery. A major benefit of cryoablation is that in a significant percentage of cases, cryoablation naturally stimulates the body's immune system to develop an immunity to the cancer as it eats up the dead tumor. In our book, we referenced an early study by Tanaka, a Japanese doctor who is able to achieve a 47% remission rate for at least 5 years among a small pool of women presenting with inoperable breast cancer. Tanaka froze their tumors and used no other therapies. Many of you are aware of this miraculous ability of cryoablation to stimulate the immune system. In fact, Here at Fuda, it is an essential component of their CIC protocol, which boosts the immune response after freezing. My husband had prostate cancer in 2010 and was treated by high-intensity focused ultrasound, a procedure that leaves the cancer DNA intact, which also stimulates the immune response. In 2014, we visited Fuda, where we were both treated with the CIC in hopes that it will help fight any latent cancer in us. But our level of awareness regarding the protocol of the immune response is rare in the United States. In fact, we do not have the equivalent to CIC, which actually uses the ability of cryoablation to activate the immune system to fight cancer. This is because there is no statistical base of evidence in the U.S. which documents the ability of cryoablation to stimulate the immune response. In fact, cryoablation for breast cancer has largely been ignored in America. The Chinese began using cryoablation to treat breast cancer about the same time as Dr. Latripp treated me in 2003. But the number of women using cryoablation in the U.S. is still low when compared to the impressive 3,817 Chinese women treated with cryoablation for breast cancer in the same 13 years. The fact that these tremendous advances in China have not been duplicated in the U.S. is disturbing to me. As activists promoting cryoablation in America, I and my husband have tried to identify why the progress in America is so slow, and then conceive of a solution to this problem. We believe we have found the answer. In America, cryoablation is seen as experimental treatment that needs to be statistically proven effective before it is considered a safe alternative to a mastectomy and lumpectomy. FDA trials of cryoablation for breast cancer have been undertaken for the last 13 years, but the size of the trials has been limited due to lack of funding. As a result, the data is considered insufficient to prove that cryoablation is as safe or effective as surgery. Given this situation, when a doctor advises treatment for a patient with breast cancer, cryoablation is considered an unproven experimental alternative to statistically proven surgery. Without statistical proof through trials, cryoablation is not used. But if cryoablation isn't used, there are no resulting statistics proving that it works. This conundrum is like a person who can't get a job because they have no experience. Yet the only way to get experience is to have a job. This lack of statistical proof has doomed cryoablation in the U.S. to remain an experimental treatment. My husband and I, as well as Ingrid, have spent many hours brainstorming and believe we have come up with a new way of treatment that will get cryoablation around this American dilemma. An emphasis on early detection, which fortunately is present in America, is a key component of this new treatment. Annual mammograms are advised for women over the age of 40 in America, and because of this early detection movement, women are often finding something suspicious in their mammogram. Since it is not yet identified as cancer, they are told to wait and see if it develops. But women don't want to wait and do nothing for 6 months, for this 6-month wait and see period. No, they are ready for action and want to do something about this something suspicious, if they can. At the end of the waiting period, women breathe a sigh of relief if there's no tumor. But if there is cancer, cryoablation is compared to surgery, as mentioned before, and American doctors do not advise cryoablation due to its experimental nature. So only surgery is advised. But what if there was a different approach that was a relatively benign early treatment? one that women would not fear, which would make them eager to detect something suspicious as early as possible. Then women would totally embrace early detection. So what we suggest is a new protocol which accompanies early detection. This protocol would call for using cryoablation to freeze anything suspicious found by early detection. Why wait for something to manifest as a tumor? Why not keep the patient's safety uppermost in the mind and ablate the unusual tissue, and then follow up with more imaging? We have named this the early freeze protocol. Cryoablation can't hurt the breast. It is almost painless and relatively inexpensive. And if something suspicious returns, a doctor can use cryoablation repeatedly until the condition either goes away or, despite the cryoablation, becomes, if it proves by biopsy, we have a typo, as cancer, which it can then be treated by surgery or, hopefully, cryoablation. This is a proactive rather than a reactive strategy in dealing with breast cancer. There is a procedure for this kind of, there is a precedent for this kind of protocol in treating other pre-cancers. A dermatologist often freezes a small skin tag or lesion discovered during a routine exam. And cryoablation is the current gold standard used by a gynecologist to freeze a cervix at the first sign of abnormal cells found on a pap smear. 6 months after cryoablation, the pap smear is repeated. Cryoablation is performed in this case as a preventative measure without any diagnosis of cervical cancer, just a suspicious finding. If this new early freeze protocol were used on enough patients, the power of the natural occurring immune effect stimulated by cryoablation will start to show itself. If something suspicious is frozen and it actually was breast cancer, then, because of the immune effect, it's likely that a significant number of those cases will be put into remission. Over time, a statistical pool will be accumulated, which demonstrates that women treated through early detection followed by early freezing will actually develop significantly less breast cancer than those who simply wait for something suspicious to manifest itself after early detection. We are convinced that this early freeze protocol will allow cryoablation to accumulate a massive statistical base of evidence that proves its efficiency. Allowing cryoablation to prove itself in this innocuous and low-cost way eliminates the need to engage in expensive clinical trials, attempting to prove that cryoablation is superior to or as effective as surgery, although efforts to prove that it is just as effective, if not better, can and should continue on a separate track. The early freeze protocol will give women what they need: less breast cancer, with minimal, almost painless treatment, which is what women want. Many women avoid mammograms and early detection out of fear that they might have cancer and their only treatment is a mastectomy. The medical community must put the safety and well-being of their patients first by empowering their patients with a less devastating alternative. If women knew that they could avail themselves of the early freeze protocol at the earliest sign of something suspicious, they would eagerly seek out early imaging of their breasts because it would give them something to do immediately rather than having to wait to find out they need a mastectomy. This would make early detection a win-win rather than a tear, and this should result in less breast cancer, which will save millions, if not billions, of treatment dollars, which can be applied to other health conditions. My husband and I would also like to advocate at this point for one other addition to the early freeze protocol. We believe that if infrared thermography, such as that done by our friend Inga Enstrom in the U.S., was added to the standard of monography, It would provide a physician with additional information regarding increased heat in the suspicious area as well as increased blood flow. Both these are indicators of that a tumor is developing. With this information, a physician would have even greater confidence in that an early freeze is justified. My husband and I have worked hard to spread the awareness of cryoablation for breast cancer in the United States. We both appreciate and honor all healers. We appreciate everyone here and value your healing abilities. I know you take your craft seriously, or you wouldn't be here. I too take my craft seriously. I believe art heals. As I leave you with some images inspired by my own healing journey, I ask you to consider my thoughts today and consider the idea of using cryoablation as a cancer preventative as well as a treatment. Here's a couple of my images. And as a woman who has survived breast cancer and has talked to hundreds of women who have breast cancer, I can tell you honestly, an early freeze protocol is what women need and what women want. Thank you.